Assalamu alaikum. Hello and welcome to another live talk on this very important topic of metabolic syndrome. Metabolic syndrome, what is it? Metabolic syndrome is interchangeably called or known as metabolic syndrome, syndrome X, or insulin resistance syndrome. I'm talking in English only because a lot of requests have come through to talk in English. A lot of people they are participating from overseas and they are unable to understand any other language other than English. So, on people's request, I've decided to talk only on English. And also, I prioritize the topics as per requests sent through to me. So, this topic was very important selection based on uh, your request and feedback. This topic is actually it's a pure medical terminology, metabolic syndrome, which consists of cluster of medical conditions or the combination of medical disorders which are collectively called metabolic syndrome. This includes high blood pressure, obesity, mainly the truncal obesity, truncal or the abdominal obesity, high cholesterol, and insulin resistance. People who this is the criteria of to meet this syndrome is actually uh, uh, one of the five or six different conditions. If any of you or any of your known person or any of you know uh, uh, have one of these five conditions, will meet the diagnosis of metabolic syndrome. Excessive fat around the waistline or the lower abdomen or the tummy, raised level of triglycerides, one of the cholesterols. Cholesterol has a couple of components: total cholesterol, bad cholesterol, good cholesterol, and triglycerides. So the high level of triglycerides, high blood pressure, high level of bad cholesterol, and low level of good cholesterol, which is called LDL and HDL, and the type 2 diabetes or the insulin resistance. So if any of the people have got one of these three conditions, meet the criteria of metabolic syndrome. Metabolic syndrome, people who have got the metabolic syndrome are at high risk of getting strokes, heart disease, and type 2 diabetes. People living with metabolic syndrome have twice the risk of getting heart attack and stroke, and five times risk of getting type 2 diabetes or non-insulin diabetes mellitus. I'm giving you a few figures uh, that I've got from the internet. They are recent studies. The metabolic syndrome affects about 20 to 30% of adults living in Australia. It can also affect children and adolescents, whereas same disease prevalence in Pakistan is between 18 to 46%. Why this syndrome happens? Syndrome itself is not the disease or it's not illness, but it's a combination of different issues and different medical problems which can lead to the deadly diseases or deadly problems which has very high mortality rate if they're not diagnosed or controlled on time. Why this happens? This happens because of the uh, today's life. We don't have time. People don't have time. It's a fast-paced life. People are working longer hours, distance are longer, people are getting stuck in the traffic, they come home tired, they eat junk food, they eat outside food which is not made in their homes. So they are eating junk food or unhealthy food, quick food, which is they are eating in different times. They are skipping their breakfast, they're skipping their lunch, skipping their dinners. So whatever they can get uh, on the go, they just quickly get the meals and go. So that in turn uh, making people fatter. They are getting more bad fats in their body, so which is accumulating in their arteries, which is causing the high levels of good cholesterol and reducing the uh, 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 high levels of bad cholesterol and reducing the good cholesterol levels and the triglyceride, which comes from the bad habit of eating. And also because of the lack of exercise, people are putting on weight, which this fat actually accumulates in the lower abdominal area, waist line area. I got the the I'm giving you the measurements which I've got it here. if any of you has the waistline, the uh, waistline measurement over 90% in the male, or the 90 centimeters in the male, 80 centimeters in the women. If you are over these waistline areas, waistline measurements, if you are at a high risk of getting metabolic syndrome. Metabolic syndrome is also getting very common in children and, and adolescents as well. Adolescents and the children, they are being fed by the junk food like chips, ice creams, McDonald's, KFCs, and burgers and pizzas. They are making our children obese, and they're getting into the adolescence and then getting into the adult life, which uh, in the later adult life they are getting diabetes, high blood pressure, and other medical conditions, which can cause this deadly problem, which is very difficult to control when it's become habit of eating junk food and skipping their meal on time, sleeping late, going into the late, getting up early, rushing to the work, not getting any exercise, not even walking to the work, not walking to the train sessions. In the second habit, second nature, which enables you to not become lazy and just come home and you are so tired that you not even have a time to have your dinner at home. You just go to bed and sleep, which is causing uh, accumulation of fat in your body, and accumulation of fat even in your liver, which can cause fatty livers as well, which is not directly linked to the metabolic syndrome, but it can lead to other medical conditions, which can be discussed later. The treatment and the prevention is looks simple and easy, but it's sometimes becomes quite daunting, quite difficult to follow. But it's very very important for you and your family members and your any people who have gone through this thing, or who have at risk of getting metabolic syndrome, or getting risk of at the risk of getting diabetes or blood pressure, can follow this advice strictly, and then can help them to achieve the goals and can reduce the chances of getting metabolic syndrome or these medical problems. Losing weight is very very important. The people who are overweight or obese, you can calculate your weight by BMI. You simply go on online and find out your height, weight. It will give you the BMI. You should be a healthy BMI, which is 25 and less. If you are more than if your BMI is more than 25, you are actually getting into the obesity line, and then obesity can lead to different medical problems. So basically, losing weight will help you improve insulin resistance. It will also improve getting the blood pressure lower and adjust your cholesterol levels. Just by losing weight, you can control these three deadly combinations. How to lose weight is eating well by reducing kilojoules, eating less fat, eating less salt, and increase whole grains, fruits, vegetables. This will help you reduce weight, improves your good cholesterol level, and reduce the risk of type 2 diabetes. So, but just by losing weight and eating well, you can achieve these things quite quickly. And also, it's very important for you to do exercise. 30 to 60 minutes on most days. Most days, when you say most days, we're talking about minimum 5 days a week. 30 to 60 minutes of exercise. Exercise is a combination of exercise, mainly brisk walking. Brisk walking is very, very important. Just get out of your house. If you have a big house, you can walk within your house, treadmill, go to the gym, swimming, anything you can you can do. 30 to 60 minutes. If you can't do 1 hour, just make 20 to 25 minutes walking, 20 to 25 minutes brisk walking every day, or 30 to 60 minutes walking most days, at 5 days a week. This will also help you reduce weight, improve your cholesterol level, improve your blood glucose level. That will help your blood pressure control. And before you do the exercise, if you've got high blood pressure, make sure your blood pressure is not very very high, because if your blood pressure is very high and you are embarking on exercise or running, it can cause you harm instead of giving any benefit. So check your blood pressure levels before you start running or brisk walking. See your doctors and check your blood pressure level is very very important, and also blood sugar levels. Stop smoking. If you are a regular smoker, please stop smoking. It will increase the risk of metabolic syndrome. And of course, reduce stress. We talked last time on the depression and stress. So depression can lead to the stress can lead to the stress can also lead to these metabolic syndrome, because if you're stressed, you won't be interested in doing things. This is very important for you guys to reduce stress level. Stress level, how to reduce the stress level? Give yourself a time, come home on time, spend time with the families, spend time with your children, have a chat with them what you've done all day today, talk to them what they have done all day today, and then you can share with your family members, with your friends, about what good things you have done. If they have done something which is not right, give them education, give them counseling, get on counseling from them, get education from them, how to reduce your stress level, what is causing the stress, or what you have been eating all day, why you ate outside, why didn't you take meals from your home. It's better to take meals from home cooked meal, so you can have meals on time, healthy meal, good cooked meal, so you know what you're eating, which can help you, at least we can help you stop getting the obesity. In children and adolescents, also very very important for the lifestyle changes, very very important. This include reduce screen time and increase increase sports, can reduce the risk of developing metabolic syndrome in later life. Children who are sticking to their mobile phones or tablets or watching a lot of television, you can reduce their time, taking them out for the sports. If you don't have time to take them to the sports, you can have if you have a big house, you can play sports on your backyards, on your streets, close by gyms, stadiums, sports centers. Just take your kids there. There are a lot of these sports centers are available everywhere now, especially in the big cities. Go there, take your kids there. Some physical sports which you can run, have a lot of physical activities like cricket, hockey, volleyball, football, anything, which you can take your children out and you can do that. And also make sure that your children, they eat healthy food. Don't bring your junk food home, because once you bring the junk food home, like chips and cokes and ice cream and all those rubbish things, kids know uh, where they are kept, and they will insist on having those junk food, KFCs and McDonald's and all those things. Once they have habit of eating these things, they will insist on these things. And as a parent, sometimes you can't resist your kids not eating food at home. Instead of going hungry, you say, okay, buy them this junk food so at least they can have the meals. Yes, that's fine. You can help them having the meal, but at the same time, you are giving them the bad meal, which in turn can cause this, the combination of these deadly problems, which can later on can develop these diabetes or blood pressure or high cholesterol in their body, which is very, very difficult to control at that time. So, as a parent, it's your responsibility, as your duty, and to look after your kids, you look after your adolescents, look at adults living in your house, in your home, or in your surroundings, in your workplace, your colleagues. Help them achieve these goals now. It's your duty as a family member, as a colleague, as a good citizen, to make your country healthy, make your environment healthy, make your friends and family members healthy. It's not very difficult. You need to do these things first before someone can follow you. So you can lead this thing. You can tell the people that you have done this thing, and within few months time, your uh, goal has close to achieve, or you have achieved your goal. Show pictures to your friends, your family members, your children, so they can inspire from you, and they can also think that it's easier to achieve these goals. Please don't take these things lightly. It's a very very serious condition. It's an epidemic, actually. It's a very rapidly spreading problem all over the world, especially in our countries, where the people have limited time because of the traffic jams and long distances. By the time they come home, it's already dark or getting darker, and they're stressful life. Coming back home, they're very tired. So you need to make sure you have to balance your life. You need to balance your life. Come home, even you are tired, have a quick rest at home, have a dinner, have a cup of tea, spend time 15-20 minutes at home, then try to get out of your house, walk about, maybe you in your streets, get out of your house, take your kids, take your wife, take your husband with you, take your brother, sister, take your friends out, just walk, you have a chat and walk. Brisk walking will make you feel better. When you come home, you will feel lighter, you will feel much better when you come home, and you will feel pride as well that you have done something today. And that will, if you keep doing this thing, this will become a habit of you to get out of your house, take your family members with you. You can have a good chat while you're talking, and you can see people around, you can see what's happening outside your work area, outside your study area, outside the other thing. When you go out, you see people doing other stuff. You will actually, you will distracting yourself from the everyday routine life. And then you can entertain yourself by getting out and see other people what they are doing while you're walking around your area. Then you can see what's happening in your area too, what new shops have opened, what people are doing, what new activities are happening in your area. You might see the new gym has been opening in your area. New activities has been announced by the local council, or the the social groups. This is very important for this, very important to you guys to share this information to your loved ones, your friends, on your social medias, WhatsApp, Facebook, anywhere. Just tell the people that this is the thing you have learned. A lot of people, they might not be able to understand what the metabolic syndrome is, but now you know what the metabolic syndrome is. A pure medical terminology, but basically it's about diabetes, blood pressure, high cholesterol, and obesity. So this is, and you all know that, we all aware of that. These are the deadly combinations, or the individually they are also very quite deadly medical problems, which can lead into the not only the medical conditions, but it's very expensive too. You have to spend a lot of hours seeing doctors, doing medical tests, buying medications from you, from medical stores, spending a lot of money, time. It's time consuming, and it's a quite bothersome problem, because you will be restricted on a lot of diets. You can't eat it. You can't eat that. You're going to the parties. You will restrict yourself to not to eat that. But at the party, you cannot also uh, refrain yourself not to eat. You will definitely eat something, which in turn you will feel bad about yourself. The what you've eaten, the why you've eaten them. Tomorrow your sugar will be high. Tomorrow your blood pressure will be high. Tomorrow your cholesterol will be high. You will also put on some weight. So it's not burden on one individual pocket. If you think in a broader way, if you think outside the box, it's actually the whole economy is suffering because of this problem. Whole country is suffering. Government is spending a lot of money. Government is a lot of resources are being spent on this, to educate people, onto hospital, to supplying free or subsidized medication to help people who have got these medical problems. And not only this, if you are diabetic, or if you got the high cholesterol or the blood pressure, you can pass it on to your children. You can pass it on to your generations. They will get gift from you as a newborn, or the children of your from you, that because you got this thing, so you have passed it on to your loved ones. And the things are getting very expensive these days. If you buy the just one, if you're taking one tablet for each problem, if you go and ask the pharmacy how much it actually costs, it is quite heavy cost just for the one tablet. If you're taking one tablet each for each problem, you are taking about 3 to 4 tablets every day. One tablet in Pakistani currency will cost you uh, roughly about a couple of hundred rupees every day. And if you convert it into Australian dollar, it will cost you about $5 to $8 every day if you don't have healthcare card. So you are spending a lot of money on just on yourself, just on the medication, just because you could do these things very easily. Now you haven't done so. Now you have this medication for long period of time, unless you really seriously think about it, and you can actually reverse this condition. These all reversible condition. These all preventable and reversible. In most of the cases, they are reversible. I have treated my patient. I have seen my patient. I have given them advice to my patient. I have counseled my patient. I have seen patient whose blood pressure is come back to normal, whose diabetes is come back to normal, who are not obese anymore. Their cholesterol level is back to normal. I had a patient who was taking 7 to 8 different tablets for many years. Now he has taken not a single medication. He is on no medication whatsoever. He just maintaining his best possible weight. And he's taken a membership with the gym. He goes to gym every day. He spend time. He has balanced his life. He comes home on time. He spends time with his family. He goes out with his wife to the gym, and he's spending time on the gym. Whatever he can, he just is spending time in the gym. I'm just it's just one of the examples I'm giving. I've got too many examples that I've treated my patient this way, and I'm sure you have seen this. So you have seen a lot of patients, a lot of people. They have actually reversed this condition just by taking up common sense lifestyle changes in their. A lot of now you can see these days, social media, Facebook, they are full of uh, ideas how to control your weight. There are different exercises they are showing every day. Everything is literally free. You can just go on internet, go on Facebook. You can just, if you see those things they're happening now these days, gyms are 24-hour gyms. You have literally no excuse not to join the gym. You can go to gym anytime you like, whenever you got time, whatever you got time. You don't have to spend hours and hours on exercise. Go to the gym, go to the swimming, go about a walk. Just common sense, small approach will make your life and your loved one life very, very easier. Save your generation, save yourself, save your wife, save your husband, save your brothers, sisters, your colleagues, your country people, and show them that you care about them, and then definitely they will take the message home. They can help their families, their homes as well. So it's a chain reaction. It's a good chain reaction. If you start from today, from your home, from yourself, and you spread across to your families, your friends, and your office and your schools, and wherever you go, wherever you belong to, wherever your company is, if you spread these things everywhere, I'm pretty sure that you will make a good impact in not only in yourself, in your friend, in the whole general society. So these are the message for today. So I'm sure you have taken it seriously. You have shared this with your friends and families, and you'll keep sharing this. Sure, this talk will be saved on my Facebook. So please keep listening to it, keep sharing, keep forwarding to your friends and family so they can get benefit from this talk. Find a new information about this simple, easy information in your language, and pass it on to your loved ones. This is a free talk. I will not. I'm not going to charge. I'm not charging anyone for this. This is a free talk. I'm giving my time. I've come back from today is Sunday. I worked as well, and this is my family time. I'm giving my family time to you guys, so you can get benefit out of that. So please do the same thing to your family members. Make a delicate balance of your work, stressful work, your shift work, your life, and your business. Give time to your families. Give time to yourself. Give time to your health. Give time to your lifestyle. Reduce the stress. Reduce the junk food from your thing. You have all the rights to eat junk food, but not on the regular basis. Once in a month, once in a fortnight, go out, take your families. You can eat whatever you like, but when you come back home, go back to the same routine. At least you can compensate what you have done, what you have been doing in the past years, so you can bring your healthy changes into life, which will definitely change the whole scenario around you. God bless you. Please, any questions, inbox me or throw online. I can answer it to you. As per your suggestions, I keep changing my priority list. What is the next topic? The next topic will be on the insomnia or the sleeping problems. A lot of people have requested for the sleeping problems. They have a variety of sleeping problems due to a variety of reasons. And the next time talk will be every fortnight instead of weekly, because of my professional commitments, my other commitments. It becomes quite difficult for me to commit every Sunday. Sunday is quite busy social day for us. Now we have to go out as well with family. So everybody's getting ready except me. I'll get ready now. So every Sunday is quite difficult. So I apologize for that. I said every Sunday. Now we'll start every fortnightly. Definitely every fortnightly we'll do this. If I can't make it on Sunday, I will do some other day. But it will be every fortnight. We'll do talk for half an hour. Very, very important talks. Very, very important medical subjects, which are very, very important. Will have a long-lasting effect on you and your loved ones. So next topic will be on insomnia or sleeping problems. Sleeping problems for any sort, any kind, for any reason. You may be having less sleep, you may be having difficulty falling asleep, or you'll be waking up and you're not going back to sleep. I mean, you'll be waking up early in the morning, and it's causing, if you don't sleep very well, your next day is going to be ruined. It's next day going to be a big problem, which can again in turn causing all these problems that we just discussed. So the next topic will be on sleeping issues. So please brainstorm and try to get a little bit, around this topic. Read your information of, or you have any sleeping issues with yourself or people you know. Uh, get answers from questions from them. I'm happy to answer all those questions. Please shoot any questions that you have in your mind. Inbox me if you don't want to uh, go live. Please inbox me. And one more thing before I go, I don't use Facebook Messenger. I don't have Facebook Messenger. I don't know how to use it. I've never used it. Probably I will not use it. So just inbox me. I hardly uh, people have people have sending me message that you're not replying on the messenger. I don't have messenger. I don't use messenger. I don't know how to use the messenger, and I will probably not use the messenger. So please direct inbox me, or you can inbox MC Victoria. They can shoot it to me, or whoever is sharing my thing. Please, you can inbox me as well. They can send me, or you can ask them how to send questions to me. They will help you direct to me, and I can reply you direct. And also, before I go, I thank you very much for Victoria and AMC Academy, who I've been um, monitoring them. I've been watching their tutorials and lectures. They are doing excellent job. Dr. Arslan Siddiqui and Dr. Jamal, they both are doing very good job for young doctors, because they both young doctors. They've gone through their own. They've done their AMC Part One, Part Twos. They both are doctors. They are doing excellent job. I'm very happy, and I highly recommend you guys, whoever is doing MC Part One and Part Two, join their academy. At the moment, they are only doing Part Two, but probably they will help you with the Part One as well. They are excellent. They are well. They are very academic people, both of them. Join them. Ask your family and friends to join them. Get maximum benefit from the AMC Academy. If you are preparing for the MC exam, or you are intending to come to Australia, they can also help you in other Canadian and American other exams. The medical never changes. So thank you very much. God bless you, and inshallah, I'll talk to you